Have you ever faced a complex patient scenario, feeling overwhelmed by a mountain of data and wondering how to piece it all together for a clear diagnosis or treatment plan? It is a common challenge, especially as you navigate the intricate world of medicine, where every detail can be crucial. The best way to analyze medical cases, particularly for students and practitioners, is by consistently applying a structured and systematic framework. This deliberate approach ensures thoroughness, promotes critical thinking, and ultimately leads to more accurate and reliable clinical reasoning. It is the gold standard for navigating the complexities of patient care. A systematic approach is invaluable because it provides a clear, logical roadmap through the diagnostic process. It helps you to meticulously organize information, reducing the chance of overlooking crucial details or making premature conclusions based on incomplete data. By following a clear sequence of steps, you build a reliable foundation for effectively generating, prioritizing, and refining your differential diagnoses. This structured thinking is not just a technique. It is the fundamental bedrock of sound medical judgment and efficient problem solving. To truly master medical case analysis, begin by meticulously gathering all available information. This includes a comprehensive patient history, detailing symptoms, past medical conditions, and social factors. Follow this with a thorough physical examination, observing and assessing all relevant body systems. Next, carefully review all relevant laboratory results and imaging studies, noting any abnormalities. Once you have this complete data set, identify the key findings and synthesize them into a concise problem representation. This involves summarizing the patient's core issues, their duration, and any pertinent context, essentially creating a one-sentence summary of the case. Next, you will generate a broad differential diagnosis, listing all plausible conditions that could explain the problem representation, even the less common ones. From there, you must critically prioritize these potential diagnoses based on their likelihood, considering factors like disease prevalence and their urgency, assessing the potential for severe or life-threatening outcomes. With a prioritized list, you can then formulate a diagnostic and management plan, outlining the next steps to confirm or rule out your leading hypotheses and initiate appropriate, evidence-based treatment. Finally, always take time to reflect on the case, considering what went well, what was challenging, and what you learned from the experience, integrating these insights for future cases. An advanced technique used by experienced clinicians, which you will naturally develop with practice, is building robust illness scripts. These are sophisticated mental frameworks that connect a specific disease with its typical epidemiological features, pathophysiological mechanisms, and characteristic clinical manifestations. For example, an illness script for pneumonia might include a patient profile, common symptoms like cough and fever, and expected chest X-ray findings. As you analyze more cases using a structured approach, you will continuously build and refine these illness scripts, allowing you to recognize complex patterns more quickly and efficiently, even in atypical presentations. This transition from a novice, detail-oriented approach to an expert, pattern recognition approach is largely driven by the development and refinement of these internal diagnostic templates. By consistently embracing this disciplined, systematic method for case analysis, you will not only enhance your diagnostic accuracy and refine your treatment planning skills, but also significantly boost your confidence in managing even the most complex patient presentations. This approach transforms potentially daunting medical puzzles into manageable, solvable challenges, equipping you with the essential skills for a successful, impactful, and rewarding medical career.